welcome everybody to the Iowa State University Extension Dairy Team monthly webinar. Today's topic is what fungus are we seeing in the cornfields? And if we have mycotoxins, how do we deal with them in our dairy rations? Our first presenter this morning is Ed Zawodzki. Ed is a plant diagnostician at Iowa State University Plant and Insect Diagnostic Clinic. Earned his master's degree in plant pathology in 2010, and his focus was field crop diseases. Ed, what are you seeing around the state this season?
My name's Ed Zawodzki. I am filling in for Allison Robertson today. So she's our corn pathologist for the state, and she regrettably couldn't be here. So if I do great, then I'll accept all the praise. If not, you can file your complaints with Allison. So yeah, and I'm going to focus on, Fred asked, what are we seeing out in the state? And the answer is, for me as a plant pathologist, unfortunately, not much. We're not seeing a lot of any diseases, much less ear rots, mycotoxin producing ear rots. But yeah, we're not seeing much. So I'm going to kind of just talk overview here about what are the common ear rots that we see, what mycotoxins do they produce, and kind of how you can mitigate damages and losses from those. So first of all, like I said, we're going to talk what are ear rots and why you should care is mycotoxins, right? Which so common ear rots that we see in corn are listed here. Most commonly, at least with my career at the diagnostic clinic, what I've seen the most would be Aspergillus, Fusarium, Gibberella ear rot, all of which produce different mycotoxins. So they are important. And some of these other ones I see from time to time, but not very common. And like I said, highlighted in red here, Aspergillus, Fusarium, Gibberella, and Penicillium are the ones that we're focusing on that are mycotoxin producing, right? So mycotoxins, right? They are secondary metabolites that are produced by some fungi. And as I'm sure Brady will talk to you about in more detail later, they can be toxic to farm animals, wildlife, humans, loss of appetite, lethargy, incoordination, difficulty breathing, all that good stuff. So that's why it's important for us to watch out for ear rots and not just ear rots, but ear rots are probably our primary producer of mycotoxins. So where do they come from? I've just got a basic disease life cycle here, right? So looking at part A, almost every disease that we see in corn and soybeans resides in residue overwintering, right? And then when the conditions are right and the plants are of the correct size and growth stage, we can get infection, and then we can have these ear rots on the ear again. So if you've ever listened to Allison talk, or myself for that matter, or any good plant pathologist really, they've talked to you about triangles, disease triangles in particular. And so I'm going to talk about what do triangles have to do with these ear rots, right? So, darn, I don't have my animations, but we'll live. So the disease triangle any triangle has three sides, right? And we need all three of these sides to have disease, okay? So one side is a susceptible host, one side is a pathogen, and pathogens are disease-causing biological agents, right? Fungi, bacteria, viruses, nematodes. And then we also have to have a favorable environment, which is arguably the most important part of the triangle, but also the part that we have the least control over, right? So just to elaborate on these things a little bit more, when we're talking about the pathogen, it's surviving in the crop residue or the soil. There's some variation sometimes in these pathogens, but largely that part of the triangle is and what I would say is, like, I've had people contact me in the diagnostic clinic. They want to know what diseases are in their field so that they can eliminate them. And while I admire their optimism, I'll call it, that's not something realistically that we're ever going to do, right? We're never going to eliminate pathogens from the equation of the disease triangle. They're out there. they're surviving on residue. Sometimes they're surviving on alternate hosts in ditches or other places, right? So it's not a part of the triangle that we're going to really eliminate or eradicate, right? So we just kind of have to deal with that. The pathogens are there. Sometimes they're there in different abundance, but they're there. The host, that is something that we can work on. So genetics vary from host to host, right? Or genetics vary within a particular host. In the case of corn, we can breed for tighter husks, faster drying down, and more upright ears to help with ear rots in particular. But yeah, this side that's the environment is really important, and it's kind of the pivotal thing that affects how much ear rot or any other disease for that matter we're going to be seeing in a particular year. And with it being as dry as it's been in the last 2 to 3 years, depending on the part of the state or the part of the country you're in for that matter, or the part of the world, right? Here in Iowa, it's been really dry. So we have not been seeing a lot of diseases, period, much less ear molds. So that environment, though, is a big driver. It really dictates what we're going to see in a particular year, and it should dictate what actions you guys are going to take or anyone's going to take with regards to ear rots or other diseases. Just really quick, we're going to talk about some of the favorable conditions for these, particularly the ones that produce mycotoxins. So your aspergillus. This is kind of the outlier with regards to a lot of fungi, right? Most fungi like it wet. They like it a little bit warm or cool, depending on the fungus. But aspergillus is your outlier in that it kind of likes it hot and dry, and it's prevalent during droughts. Despite that, it's not something that I've been hearing a lot about that we've seen in any measurable amounts here in Iowa. So, but then, yeah, fusarium ear rot's kind of more in between, likes moderate temps, a little bit higher than average grain moisture, and gibberella is contrary, likes cool, wet conditions during the flowering period, right? So, and if you're looking at the images left to right, we've got aspergillus, fusarium, and gibberella. Along the lines of mycotoxins, they kind of shadow what fungus they are produced by, like the aflatoxins is produced by aspergillus. So it likes the high temperatures, particularly when nighttime temps are over 80 degrees. Fumonisin produced by fusariums, kind of again in that moderate place. Don or the vomitoxins, as well as Zen or the Zeroli, I'm not even going to try to pronounce that one. They're kind of in that middle place. Alternating temperatures kind of help produce Don. High moisture content help produce these Zen toxins. So how can you recognize these molds? So, basically, there's not a lot for me to say about what's out there this year, but I can help you kind of, if you're scouting fields and trying to manage these things, what can you do? So how can you recognize some of them? So aspergillus is probably the easiest to recognize for anyone out there scouting a field and looking at some of these ears. It's distinct, right? There's not a lot of other fungi that produce this kind of olive green or yellow green color. It's a very dusty looking fungus. It's very distinct when you see it, and it's the one that produces aflatoxins. Gibberella and fusarium can be a little bit difficult to distinguish from one another, but gibberella, it forms this kind of pinkish red mold, but the big key that you're kind of looking for is it usually starts to form at the tips because infection takes place via the silks. So and it may also develop around injuries though, and it produces, like I said, that Don or that Zen toxin. Fusarium ear rot's probably one of the harder ones to identify or diagnose in the field. It can produce this white, pale, pink mold. A lot of things can produce a white mold or this mycelial growth that's produced by these fungi. So it can be kind of difficult. If you look at the picture on the far right-hand side, there's the kernels are kind of reddish with white streaks in them, and people refer to that as kind of a starburst pattern. That's probably one of your best visual diagnostic characteristics of fusarium, but there are some other ear rots that can create that starburst pattern. So it's not, tried and tested 100% way to diagnose. And these produce fumonisins. And then Diplodia ear rot does not produce any mycotoxins, but just kind of to give it a shout out, it is one of the more common ones we see as well. Can produce this kind of, if you look at the photo, that really white, dense, white, fluffy mycelial growth in between some of the kernels. A good scouting tip is if you see a dead ear leaf, you might be seeing some of this Diplodia ear rot. So, shameless plug. I've been kind of pulling out of the diagnostic clinic, doing less and less in there in the last year and a half. So, but my colleague in there, Dr. Chelsea Harbach, is a great diagnostician. And what I would say is with a lot of these ear rots and any other diseases in corn and soybeans, I really highly recommend getting these things diagnosed for a lot of reasons. Basically, especially with ear rots, some of them can be kind of hard to distinguish from one another. And when the stakes are high and we're talking about the presence or absence of mycotoxins, depending on the different fungi, it's really advisable to get these things diagnosed if you do find them in any kind of abundance in a field, so that you can kind of plan your steps from there. And I'm going to use that as a jumping off point to kind of talk about that a little bit. Just, ear rot and mycotoxin management, right? It starts in the field. Like I've been saying here, hybrid resistance is probably, if you ask any plant pathologist, that's going to be number one on the list for controlling any disease if it's available, right? And it is available for a lot of these different ear rots. Just depends on where you're growing corn and what your goals are and that kind of thing. But it's something to be aware of. If you are seeing a particular ear rot out in the field, there's probably a hybrid that is resistant. Crop rotation is the tried and tested since the medieval times, right? I always tell people that when I was taking world history in high school and we were talking about crop rotation, I never thought that it would be part of my career later, but crop rotation can help with residue management, right? It can help to, if you don't have corn out there every year, there's going to be less and less of the inoculum or the parts of the fungus left in the field in the residue that can reinfect in future years. You're just reducing that every time you rotate crops, right? So, and then minimizing stress, you can do that through fertilization, population control. We can't control Mother Nature, but that would surely minimize stress as well if we could add some rain every now and then. And then insect management. So using BT traits, some of these diseases, they really rely on insect injury to get into the ear. So using BT traits or scouting for insects and using insecticides can also help reduce some of these fungi from getting a foothold in your ears. You might be wondering, why didn't I mention foliar fungicides or a fungicide application as a form of management? And there's been some work done basically showing that we don't get a lot of control of ear rots with foliar fungicides. This particular one looked at fungicide applications at R1, and they did see control in some instances. They saw a reduction or an increase in gibberella ear rot in this case, but they didn't see an effect on DON, that deoxynivalenol that is produced by produced by gibberella ear rot. And so not really a viable option for managing ear rots and mycotoxins. Just a couple more quick notes on, management and what you can do. When it comes to storage of infected grains, it's really paramount to reduce the fungal growth that can happen in the grain bin, right? So mycotoxins are not going to decrease from whatever they're at when you put it in the grain bin, but they can increase, right? So at very least, if you do have some ear rots that are producing some mycotoxins, you're not going to go down after you put them in the grain bin, but you can stop or reduce the amount that they increase in the grain bin. And that's pretty much by getting the grain as dry as you can, right? There's a lot on this slide, but basically, getting the grain as dry as you can, as quickly as you can reduce the amount of these damaging ear rots that are being produced. And there's an example there at the bottom that's basically showing with 25% moisture corn, this study that they did could increase fumonisin by up to 77% after 7 days. So pretty quick. It's really important to get grain dry in a grain bin and make sure there's enough circulation and all that good stuff going on in there. And along those lines as well, maybe even before you get to the grain bin, while you're in the grain bin. Testing the grain can help you with your decision making as well. Just basically keeping you aware of, the potential risks that you might have and how you can kind of manage them. There's a lot of different testing available, and hopefully I'm not double dipping into what Brady's going to talk about. But yeah, there's a lot of testing available for mycotoxin affected grain. I know here in the diagnostic lab, we've sent a lot of samples over to the vet diagnostic lab here on campus to test for these things in feed samples. So there's lots of testing available. I would take advantage of it. The one cautionary tale or whatever you want to say, I would say, is that mycotoxins in a grain bin or in the field rather can be rather ununiformly distributed, right? So you can have hot spots. If you look at an ear of corn, right, not all of the kernels even might be infected on one ear, much less in a grain bin. So just as an example, you have here at the bottom that single kernel can contain up to 207,000 parts per billion, or 8 kernels in a bushel can exceed 20 parts per billion. So pretty rapid reduction, but one kernel can have a lot. And you can imagine that if you have a hot spot in a bin, you might have a lot of a particular mold and maybe a lot of mycotoxins. So it's important to get a good representative sample when you're sampling for these tests throughout the bin or throughout the sampling or throughout the collecting of the grain in order to see what overall you might be dealing with. I had some hidden slides that were popping up there, but useful resources, folks. I do a lot of work with the Crop Protection Network. They have some wonderful resources that they try to increase the scope beyond just Iowa or just any particular state. So it's a nationwide effort where they're putting out resources like these two here, one on ear rots and a kind of a FAQ about mycotoxins. I highly recommend checking these two documents out and visiting the Crop Protection Network in general. A lot of awesome resources on there. Kind of in summary, corn is susceptible to a lot of pathogens, right? We all know if we've worked with corn at all, particularly ear molds in this case. Some fungi can also produce mycotoxins, and mold that develops. It's based on that disease triangle. If you take away one thing, remember that disease triangle, and remember the environmental conditions that could really bump up some ear molds. We haven't been having them in the past few years, but people are dipping back into the archives and watching this webinar. It'd be something to check out what the weather's been like as far as some of these ear molds are concerned.
Our next presenter is Brady Gates. Brady is the owner of Gates Dairy Consulting, works with GPS. After graduating from Northeast Iowa Community College, he spent 3 years as a herdsman in Eastern Iowa, managing operations and employees while building his network. He went to Iowa State, where he received his BS in animal science, and then joined Dr. Baumgart's lab to pursue his PhD. I met him. He was very active in helping manage feed out at the Iowa State University dairy. So was kind of excited when I could get him to be part of this presentation. As I always say, Brady, the podium is yours.
Awesome. Well, thanks, Fred, and thanks for the invite to present here today. Appreciate everybody attending and appreciate everybody tuning into this if you're watching later on. So some things are going to be a little bit repeated from what Ed talked about, not too much. And the purpose of my talk today was, so we have mycotoxins in the field, we have those, how do we manage those in dairy rations? So can you guys all see my screen, I'm assuming, right? Okay. So again, just a little bit of a background on mycotoxins. Just like Ed just talked about here, most mycotoxins are produced in the field. But like he also mentioned, some can also be produced in storage. So a majority of them are produced in the field, but when they're in storage, we can still see some more of those proliferating. And, it's variable year by year. This year is a pretty dry year. We've had a pretty good growing season. We've had, pretty much a limited mycotoxins present in crops. But A few years ago, we definitely saw increased levels of those. And those are multiple factors playing into that: weather conditions, insect pressure, crop rotation, everything that Ed talked about. And while management can reduce, it can't totally prevent the occurrence and the concentration of the toxins. So even despite our best management, despite our best efforts, we might not be able to control or prevent all mycotoxins from being present. So why do we care? Why does this matter to us? Well, worldwide, there's approximately 25% of crops are affected by mycotoxins. This can extrapolate into billions of dollars. In the United States alone, the estimated impact on the economy can be generated from decreased productivity in livestock, increased losses in the crop, as well as there's costs and effects with the regulatory programs, right? When it comes to these testing and things like that, these are all costs that are associated with these mycotoxins. So what are some of the common mycotoxins that we see out in the field? Well, there's Fusarium bacteria like Ed talked about, Aspergillus, as well as some other species. And some of the main ones that we really see here in the upper Midwest, and I'll kind of focus on that area, is that deoxynivalenol, zearalenone, some T2s, fumonisin, and in the southern United States, or in more wetter conditions and hot conditions, we can see more of those aflatoxins. I'll get into that a little bit more here in a minute. So, how common is this? We talk about mycotoxins, they're present. Okay, what does that mean? How often? How much do we see those? Well, this 2019 study was a study that went over a 10-year period from 2007 to 2018. And here we can see that DON is the most prevalent at 64% in those samples, followed by fumonisin, zearalenone, and aflatoxin B1. And most of those aflatoxins were found here in the United States, and most of those are common in the southern United States, again, because of the weather conditions, the growing conditions that we have down there. And not only can we see just one toxin, but it's typical to detect more than one. 64% of samples have more than one toxin, and it's not uncommon to detect five or more in a sample. And most likely we're going to see the combination of those most prevalent ones, right? The DON and fumonisin, the DON and zearalenones, those type of combinations are what we're going to see. And as our testing methods become better, and as we test more samples, we're going to find more mycotoxins. That is one of the things that we do. When you test more, you find more. So, what do these mycotoxins do? What are they doing in the animal? Well, everybody's potentially seen something like this, right? Where we see that, the various bugs that we have, or the various mycotoxins that we have, they can contribute in various ways, whether that's mastitis, lameness, decreased milk production, it alters repro, all of these little things. So these mycotoxins have a wide array of effects. And I'll get into a little bit more, are those direct effects, or are those indirect effects? So when it comes to symptoms, so what are we seeing, right? I think I got mycotoxins on my farm. What are some of the symptoms? What are some of the signs that I can see those in my cows, or that I know that they're present? And to be honest with you, some of those symptoms are vague and non-specific, right? We might have a reduced feed intake. We might have increased feed refusals. Cows just aren't eating as much as they used to be. Milk production drops. Manures just don't look as normal as they used to. We're having a little bit more digestive upsets. Maybe there's some DAs going on in late lactation cows, and poor reproductive performance, or even some late-term abortions. There's a lot of things that can contribute to all of these things that I just said there. Mycotoxins are one of those. In addition, if you look at these pictures, we can see some of those inconsistent manures and some looks like spit up cud, and that's that vomitoxin, that DON vomitoxin that we talked about. Cows can actually vomit. It induces that action in them. Mainly in pigs is where that's really been present. So when it comes to testing for these mycotoxins, right, we want to test for them. We want to know if they're present. We want to know how much they're present. An issue with that, especially in our dairy world, when it comes to these forages, we're talking tons and tons of silage that we're here, as it's difficult to get a representative sample of that silage. Mold growth can be inconsistent. We might have it in the bottom left of the pile, but not in the upper right. And it just so happened that day we grabbed the sample from the upper right. And these mycotoxins aren't uniformly distributed like Ed had mentioned there. And there's several commercial labs available if you want to test for these mycotoxins. However, there's some limitations to those, right? It's only limited to a few toxins. They're really expensive sometimes, and they might take a little while to get back. And while this cost is a constraint, these are really while the cost may be expensive, they're really insignificant compared to the economic losses in productions. So the reason we need to test is look at these two feeds on the right here. Which one has mycotoxins? We can't see them. We don't know they're there. So we got to test in order to know whether we have mycotoxins or not. And so we do find the levels of mycotoxins, but what does that mean, right? Do we have clinical or subclinical levels? And what does that actually mean? You know, in large quantities, yeah, we might see acute health problems and production problems. We might see animals die if they ingest a large amount of mycotoxins. It's very, very scarce do we see that, very seldom do we see that, but it is real. If you have a large dose and cows consume that, there might be some adverse health effects from that. More than likely, we see chronic exposure, right? She's exposed to mycotoxins every day, a low level or some sort of level. And it's that low level consumption over time that can interact with other stressors. And I'll get into these stack stressors here in a little bit, and we'll talk more about that. And this is where we really see those subclinical losses in production. You know, that production just hasn't been where it's at for the rest of the last part of the year here. So, you know, what's going on? Maybe it is mycotoxins. And, you know, repro conception rates have really been struggling. So it's that low level, that chronic exposure to these mycotoxins that's really going on. And it's these subclinical losses that are of greater impact to producers. But again, they're really difficult to diagnose and they're really troublesome, and they cause a lot of issues on dairies. So let's take a second here and let's talk a little bit about what these mycotoxins are doing. You know, is it directly the mycotoxins or is it indirect? So in order to do that, I got to give a little bit of a background on the GI tract and inflammation. So the gastrointestinal tract can be thought of as a tube running from the mouth all the way to the anus. You know, if you've heard Lance Baumgart, my PhD advisor, speak before, we all talk about this. You know, everything inside that tube is technically outside of the body. And there's multiple roles of the digestive tract, right? It has to digest and absorb nutrients, but also more importantly, it has to prevent parasites and pathogens from infiltrating. It has to prevent those mycotoxins from being able to be absorbed into the bloodstream and having an effect on the animal or activating the immune system. And we know that stress can cause leaky gut. You know, this gut become leaky, we can have issues that go on to there. And there's many sources of inflammation that can be affecting that. You know, you might have pneumonia in the lungs, you might have mastitis or metritis in the uterus, mastitis in the mammary gland, or the gastrointestinal tract. So if you look at this figure here on the right, we have a healthy gut epithelium. We can see that we have bacteria and LPS or lipopolysaccharide in the gut lumen, and we have nutrients that are being absorbed into the portal bloodstream. And we can see that these cells here on the intestinal epithelium have these tight junction proteins. And that's the barrier that prevents these toxins and pathogens from infiltrating. Well, now we have a stress event that goes on, you know, that could be from physiological stress. You know, she's just overcrowded in pens. We have heat stress going on, maybe feed restriction. We didn't push up feed as much as we should have, or we ran out of feed the last couple of mornings with a new feeder. There's multiple scenarios that can be going into that. And it's these situations that can cause stress. And now when we have that stress event, we see that these tight junctions open up. In addition, this bacteria is able to infiltrate, or these bacteria and mycotoxins are able to infiltrate into the portal bloodstream and activate the immune cell there. And that activated immune cell causes inflammation. And now that inflammation is what's energetically expensive. These nutrients and energy that were normally going to go to production are now going to fight that inflammation or that infection. And inflammation is energetically expensive. So in normal conditions, we see that glucose is going into milk yield. But now we have a stress event, and this immune activation causes an increase in insulin, because the insulin is needed for the activated immune cells. And now that glucose is shunted towards the activated immune cells. And because of that, that glucose is not able to go into the mammary gland. That's where we see our production losses. Those nutrients are now being able to fight the infection or the inflammation, and they're not going to productive processes. That's why we see the drop in feed intake and the drop in milk production. And we know that this is really expensive in multiple species, whether that's steers, pigs, or cattle, that an activated immune system requires a substantial amount of glucose. So my former colleague, Dr. Aaron Horst, put this slide together, and it's a great slide, and I love using it. But again, we have these multiple sources of toxins or issues that can be going on for situations of inflammation, whether that's mycotoxins, mastitis, or leaky gut, like I just mentioned. So we have this leaky gut occurring. Again, it activates that immune system, and now we have inflammation. And it's this inflammation that's really the cause of those symptoms that we're seeing, that decrease in dry matter intake, that decrease in milk yield, as well as some impaired reproduction, and as well as some of the other things that we might measure, ketosis or DAs, or even fatty liver on farm. And if you want to know more about that, I invite you to read review paper that Aaron and Sarah Kavidra and Dr. Baumgart presented here in 2021. And in addition, while there's pathogens that might cause an inflammation, there's also different situations that we have on farm that can cause inflammation. You know, it's this repeated and successive and concurrent stressors, the stacked stressors that may exacerbate that inflammatory response. So, you know, I'll use this graph here for an example, but we see that at dry off, just because of the dry off in general, we have an inflammatory response. At calving, we have an inflammatory response. So there's an inflammatory response there already, but now we're going to throw mycotoxins in there to exacerbate this even more. We're stacking those stressors. It's more than one that you can handle at a time. So let's go back to the situation where we have mycotoxins present. You know, what do? I know that I have mycotoxins in my feed right now. So what can I do on farm? What are some situations or what are some things that I can do? Well, we can continue to monitor those levels. You know, these concentrations can change throughout the pile or throughout the forages that we're feeding. You know, it might have been just one field where we had a lot of hail damage or we had some pressures coming from some way, shape, or form. You know, so we got to monitor those levels continually during harvest and during feed out. In addition, we can focus on clean feed. So look at this picture here on the right. We can see that it was a rain event and feed's going to get pushed up, and we have that slop and that dirt and that debris that's in the alleyway there, and we got to try to clean that up and prevent that from being pushed in with the feed. You know, again, it's a stack stressor. She's able to handle one event, but you throw clean feed or dirty feed in there and throw some mud in there, and that might be what really sets her over the edge. Minimize that contamination and make sure that we have feed pushed up. And the rumen really is the first line of defense for mycotoxins. You know, mycotoxins and monogastrics are more severe because they don't have a rumen to detoxify those. So this rumen can detoxify and make them less toxic to ruminants. However, there is some cases, like for example, zearalenone, where when it degrades zearalenone, it becomes more toxic. So while the rumen is a line of defense, it also can create some issues. And another issue that we have is that there's increased passage rate in our high-producing dairy cows, right? Feed intake is just astronomical nowadays, and we're really pushing those cows. And so sometimes those mycotoxins that might be present might not be able to be completely detoxified in the rumen. Now, when it comes to the diet, mycotoxins can't be denatured. Once they're there, we can't alter them in the pile or try to get rid of them in that way, kind of like Ed had mentioned earlier there. But we can manage how we feed these contaminated ingredients. You know, Bill had mentioned earlier there, dilution is a solution to pollution, right? Well, it's the same thing when it comes to mycotoxins. We can dilute that bad feed or that contaminated feed with some clean feed or some other forages that we have. Or in some situations, if it calls for it, we can completely remove the contaminated feed. But in our North American diets or upper Midwest diets where we're 50% corn silage, if I have corn silage that's contaminated, it's hard I can't get rid of all that. I can't throw that away. That's 50% of my feed. So we got to dilute those out, or we got to try to mitigate those in some way, shape, or form. In addition, we got to avoid moldy feed. If you can see visible mold on the pile, throw it away. And now when I say throw it away, this doesn't mean give it to your dry cows and to your heifers. I mean, get rid of it. It's bad feed. It's not good feed. All animals on the farm should be fed clean feed. One thing that we can do when it comes to diet management is making sure that we're formulating diets properly. You know, trying to make sure that we're trying to reduce that nutritional stress. We have a transition cow diet, making sure we're transitioning into those smoothly, trying to reduce those effects on the rumen and trying to making sure that rumen environment is getting adapted properly. Again, trying to maintain that healthy rumen. As I mentioned, it's the first line of defense, so we need to try to maximize the efficiency that we can get with the rumen. Some other things that we can do is we can feed these mycotoxin adsorbing agents. I did spell that correctly. It's called adsorbing. It means that it's the binding capacity of one of these agents. And these agents can be binders or deactivators. And these different binders, and I'm not an expert in binders by any means, but I'll give a little bit of a background on them. There's inorganics, and there's organic clays, organics. Some activated charcoal is a little bit older technology, as well as there's some enzyme and microorganisms. So there's various things that we can do to try to mitigate some of these mycotoxins, various things that we can feed in the diet to try to mitigate these. So what is the adsorption capacity of these various toxins that we talked about? This figure here on the right really does show kind of the adsorption capacity. You know, aflatoxins, if we have them present, luckily we can feed some of these binders or these deactivators that will bind up and eradicate most of the aflatoxins. But if you look at Don is really doesn't have a very high adsorption capacity. If we have Don present and we feed some of these binders, we might not be able to bind up as much as we think. And if you remember correctly, Don is one of the most prevalent ones that we see here in North America. And when it comes to these binders, their effectiveness can vary by pH. So it's crucial to make sure that if you're looking into a binder, that the company or somebody who's trying to sell it to you has looked at these at various pHs. You know, whether that's a 3 like the abomasum or a 6.5 like the intestine. You know, we really want to try to detoxify those, and most of them have they work best at the pH of 3 in the abomasum, but the mycotoxins can really have a major effect in the small intestine. So making sure that we're having some reactivity and some capacity there at the pH of 6.5. So how do these binders or deactivators work? Well, these absorption happens through one or more multiple intermolecular reactions. That's chemistry, and that's something that's just not my forte, but there's hydrogen binding, van der Waals forces, you know, there's various attractions, there's various sites that these mycotoxins can bind to various sites on what we're feeding, whether it's the organic clays or various substances like that. And not only is the type of bond important, but the total number of bonds, right? If we have 10 molecules of a mycotoxin, but we only have one binding site, well, it's not going to do very well. We only got 10% of it. So making sure that we have multiple binding sites and we have, you know, multiple different areas for these toxins to bind. These deactivators or these microorganisms and enzymes, they work in a different way. They're able to produce enzymes, or they're organisms that can produce some type of a metabolite or a bioactive component that's able to detoxify and remove these mycotoxins from the intestinal tract, or bind them up and carry them out through excretion in the feces. So when it comes to these binders, there is, in the United States or in North America, there is no product that is currently FDA approved for binding, for the prevention and treatment of mycotoxicosis. Now, there's several materials that are recognized as safe, GRAS, if you will, that are used in diets for other purposes, such as flow agents or pellet binders, as kind of a way that we can feed them in our dairy rations. In addition, there's no product that currently meets all aspects of a desirable binder. You know, if I have a little bit of aflatoxin and a Don and zearalenone present, and I want a toxin that's going to bind them all, there's probably not one on the market right now that can do that. And while responses to some products have been very encouraging, the results are very variable due to multiple reasons, whether that's the type of binder we're using or the amount of the binder you're using, right? Are we using 10 grams, 20 grams, 30 grams? And in addition, you know, the specific type of mycotoxins that we have and their amounts, right? If we have, again, 10 units of Don present, does that mean that I have to feed 10 grams, or do 5 grams work? You know, we need the testing and the research on this is limiting. In addition, some of the other factors are, you know, some animal species or interaction with other dietary ingredients, right? If we're feeding some of these binders, are they binding up some of our vitamins or bypass methionine or bypass amino acids? There is that risk there. And so again, maybe 10 grams might be enough, but if we feed 20, is that going to be more than enough, or are we going to create more issues than we really want? So how do I choose a mycotoxin binder? What are some things that when it comes to feeding a mycotoxin binder or a deactivator that I need to be looking into? Well, they need to be effective at sequestering the mycotoxin of interest. If I have Don present, I'm not going to feed a toxin binder that's really good with aflatoxin. That just doesn't make sense. So it may be of value to bind just one specific mycotoxin, or it might be of value to bind multiple. And sometimes there might be a combination, right? Maybe I want to feed a clay binder in addition to a microorganism, and they work synergistically in multiple different ways. One thing that's really important is to make sure that these don't have detrimental effects on the animal. And if they do have some sort of a detrimental effect, that it shouldn't outweigh the benefits of it. If we have some sort of a detrimental effect, we better be able to see a production response or some other type of response that's more positive. One thing with these binders is they can be really expensive. You know, we're talking anywhere from 2 to 3 cents up to 15 to 20 cents in some cases. And so the cost should render its use practical and profitable, right? I don't need to break the bank to try to do this if it's not if it's not binding or doing working to the best that I'd like it to or want it to. So what is the best way to prevent mycotoxins? Well, there's prevention and management is really the best way to do it. And here's some strategies that we can consider. So again, the best mitigation is prevention. Be proactive, not reactive. If we have issues in the field, we're well aware of them. What can we do? We need to get all aspects of our team on the same page, whether that's our feeders, our agronomists, and our dairy herd managers. Look, we're seeing some issues in the cows. What is the feed telling us? And what can we do next year when it comes to our forward planning, when it comes to forage plant harvest and planting? And when it comes to silage harvesting, making sure that we're using our best practices. Are we harvesting at the right moisture? Are we chopping uniformly so we can get a good pack? Are we filling the silo in a rapid manner? Are we using an effective fermentation aid or an inoculant on our silages? And are we completely covering our pile and doing it really well, so we're not, even if we have mycotoxins, we're preventing those from continuing to grow. So when it comes to bunker and pile management, the piles really should be, the size of their pile should be dictated by the size of your herd. The removal rate of our faces should be 6 inches plus, and during a hot month and during summer, it could be 12 inches at minimum there. And this rate of removal should be faster than the deterioration rate. Make sure that we're maintaining a clean face and we're trying to minimize the leftovers that are left at the end of each day. If we have a jagged edge or a jagged face, this allows for more oxygen. This allows for more growth to occur. And if we have these high moisture byproducts, such as a wet corn gluten feed or a wet distillers or something like that, we're making sure that we're getting those fed up within 7 to 10 days. And when it comes to mycotoxins being present, be thorough. Be thorough in your diagnosis. Is it mycotoxins or is it something else that's really going on? Work with your nutritionist, your veterinarian, and you as a producer should be persistent in the formation of a differential diagnosis. Mycotoxins are often blamed, and there is a good chance that they might be part of the problem, but there is other factors that are involved, right? If we have that dirty feed or we have, poor face management, our piles just wasn't put up right. There's other things that can contribute to what we're seeing in these animals. And if we do have it, make sure that we're prioritizing our high risk animals. Again, that transition period is the most stressful time in a lactating dairy cow's life, and making sure that we're trying to minimize the stress and the other things that could be present. So if we do have mycotoxins, we can reduce those stack structures. So prevention is key. So in summary, mycotoxins continue to pose a threat to maximizing productivity in dairy cows. Focus really should be on a quality ration and higher quality management, making sure that we have clean feed, high quality forages, and making sure that we're designing our feed center properly. And if you have mycotoxins, utilize a team to produce a plan. Continue to monitor those concentrations and let the cows be your guide. If we put a toxin binder in and we're just not seeing a response, maybe we need to make a change. Or, cows are really dropping, maybe we need to test for mycotoxins. So making sure that we have a team approach and everybody is involved, and making sure that the binders that we're using are research proven and science-based. That's something I really focus on, and in my PhD program really hone that in on me. If there's a lot of Me Too products out there, and there's a lot of products that don't have a lot of research. Find a reputable company that has a high quality product with a lot of research behind it. That's extremely important. And again, prevention is the best mitigation strategy. Be proactive, not reactive. With that,
at this point, I'm going to go ahead and close the program. Thanks everybody for attending.